Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us try to answer some OSCE about family planning. Okay, everybody, are you ready? Okay, let us start with the first slide here. Identify what is shown in this picture. So, this is combined oral contraceptive pills. Combined oral contraceptive pills. This is a monophasic type. Why I said that? Because this strip contains 21, 10 in this row, 10 in this row, and single one here, so the total is 21. 21 is found only in combined oral contraceptive containing acynyl estradiol plus progestin. Okay? And this monophasic type, all tablets with the same color and same dose of acynyl estradiol and the progestin. So it's called monophasic type. Okay? So the answer for this is combined oral contraceptive pills. How to initiate, how to start the dose or take the combined oral contraceptive. You should start with the first day of the menses. The first day of the menses, you start the first tablet of this drug, okay? And take each pill at the same time every day, okay? Till reaching the end of the strip at 21, because it is 21 tablets, then rest for 7 days, then use a new pack of pills. So, start from the first day of menses to ensure the efficacy. Can I start later on? Yes, you can start in the first 5 days of the menses, but the efficacy decrease if you didn't start with the first day of menses. Okay? So the best is to start with the first day of menses, taking the pill at the same time every day, okay, till the end of the strip, 21 days, then break or rest for 7 days. What else? What about if there is history of recent abortion or miscarriage in the first or second trimester? When to start to take oral contraceptive pills? Within the first 7 days. If you need contraception, start within the first 7 days. What about if recently delivered woman and breastfeeding? You should avoid COC, combined oral contraceptive pills, in the first 42 days following postpartum. If a woman is breastfeeding, as hormones impact lactation. And you should know also, even if she is not lactating but recently delivered, avoid use COC in the first 21 days because of risk of venous thromboembolism. So please remember this risk. You should avoid it completely after delivery in the first 3 weeks postpartum. Some extend this period to 42 days. What about the breastfeeding? You should avoid the first 6 weeks postpartum. But still, COC affecting lactation has bad effect or bad impact on lactation. So WHO recommend performing a risk-benefit assessment for using COC between 6 weeks to 6 months postpartum in breastfeeding women. And this is very wise to know the risk and benefit, okay, for COC use in this period between 6 weeks postpartum and 6 up to 6 months. Of course, if you're asking me, I'm telling you, if you are going to give COC for any reason, please delay it 6 months postpartum. Okay? Next question here, what you are going to do if there is missed dose, or 1 dose or 2 doses. I mean missed pill in 1 day or missed 2 pills, what you are going to do? This is an important question and a very common question, and many women using pills ask the gynecologist about this point. If patient misses a tablet, take the missed tablet as soon as they remember, and the next tablet at the usual time. Okay, so you should tell the woman, if you missed 1 tablet, please immediately when you remember, take the tablet. Then the next tablet will be taken at the same time as usual. Okay? Okay. What if a woman missed 2 tablets? In the first or second week, this is a very important because before ovulation, and of course, missed tablet in the first 2 weeks is different than missed tablet at the last week of this trip. Okay? Why? Because at the first 2 weeks affecting the ovulation. So the efficacy is decreased with missing the tablets. So what you are going to do if there is missed 2 tablets? Take 2 tablets the day the patient remembers, and the 2 tablets or pills the next day. So she missed the 2 tablets, so she is going to take 2 tablets the day the patient remember. When she remember that she forgot 2 doses of pills, then she ask her to take 2 pills in this day, and in the next day another 2 pills, then continue as scheduled before 1 tablet or 1 pill per day. Okay? This in case she forgot 2 pills. But there is something also important to do, because I'm not sure of the efficacy of pills in this month, because she forgot to do this. Although I gave her 2 pills one day and another 2 pills in the next day, then continue 1 pill per day. But still, I need additional contraception like condom until the patient begin a new cycle. So continue this month with additional contraceptive method to ensure the protection of being pregnant until the patient begin a new cycle. Okay? This is as regard the answer what you are going to do if there is missed pill. Okay, next I'm going to ask you the advantage of COC, oral combined oral contraceptive. It is highly effective in preventing pregnancy when taken correctly. As I mentioned before, start with the first step, start with the first day of the menses and continue at the same time every day up to 21, then rest for one week or 7 days, then new pack is used and so on. If it is used correctly, the efficacy is very high as a protection from being pregnant. Reaching the failure rate is about 0.1%. Imagine 0.1%, so highly effective. But the problem is with use failure. The patient may miss one pill or two pills, not taking at the same time, or another factors affecting like drugs causing decreased efficacy of pills. So the failure rate here is due to another factor. So if the patient taking it correctly, it is highly effective. So this is one advantage. Okay. The second advantage being not related to coitus. You are not taking the pill because there is intercourse in this time. You are taking the pill regardless the time of intercourse. You are taking the pill at the same time every day. So it is not related to coitus. What else as advantage? Rapid return to fertility after discontinuation. Rapid return to fertility after discontinuation. That's why combined oral contraceptive pill may be the first choice in a recently married couple who wanted to delay pregnancy for 1 year or more and asking you which is the best as the method of contraception. COC, so long as there is no contraindication, is the best choice. And the return to fertility after discontinuation is so rapid. Okay? From next month, she can be pregnant after stoppage the pill. Okay. Of advantage also the health benefits of the pills. What are the health benefits? Another question. What are the health benefits? COC decreased dysmenorrhea and considered one line of treatment of dysmenorrhea. What else? Suppression of endometriosis. In case of endometriosis, COC suppress endometriosis. Reduce the risk of developing endometrial and ovarian cancer. Improvement of hot flashes and hormonal fluctuation symptoms in perimenopausal women. Women around the age of menopause may have some symptoms like hot flashes, hormonal fluctuation symptoms, and so COC can improve such condition. Improvement of androgen sensitivity or androgen excess conditions like PCOS, for example. So this is another health benefit of COC, and you can consider all health benefits here also as an advantage for COC. So the next question is, what are the side effects? Side effects is not very common, but it may happen in some women, like breakthrough bleeding, spotting in the intermenstrual period, in the time after the end of menses and before the start of next menses, spotting may happen. We call it breakthrough bleeding. This is a common side effect really with some combined oral contraceptive pills. Breast tenderness, nausea, weight gain, decreased libido, headaches and migraine, increased vaginal discharge. This is some side effects that may happen. What are the disadvantages of combined oral contraceptive pills? Another question, and the important one. Must be taken consistently and correctly to be effective. You should ensure that the woman take the pill at the same time every day. Okay? And follow the instructions. May interfere with lactation. Okay, we know that COC has a negative impact on lactation. One of the disadvantages is there is no protection against sexually transmitted diseases. Yeah, there is no protection against sexually transmitted disease. What are the complications that may happen with COC? Venous thrombosis and thromboembolism, very important. So, if a woman at risk of venous thromboembolism, you shouldn't give her COC, because one of the important complications for COC is venous thrombosis and thromboembolism. Myocardial infarction and stroke, hypertension. These are complications may happen in a certain woman, so you should know about it. Contraindications. What are the contraindications for using combined oral contraceptive pills? Personal history of venous thrombosis. Yeah. Personal history of myocardial infarction and stroke. Labile hypertension. Active liver disease. Breast cancer. Migraines with focal neurologic symptoms. This is the end of the first question and the subtitles related to this question. We are going to see picture here, and please identify what is shown in this picture. This is another oral contraceptive pills, which is progestin-only oral contraceptive pills. Progestin-only oral contraceptive pills. The strip containing pills, usually if you count these pills, you will find it 28. In another strip, you may find it 35. So, either 28 or 35. This is related to progestin-only oral contraceptive pills. Of course, all of them of the same color and all of them containing the same dose of progestin. Okay? And there is different types of progestin. So, how to initiate or how to start to take progestin-only oral contraceptive? The pill must be taken at the same time each day to maximize contraceptive efficacy, and start on day 1 to 5 of menstrual cycle. Of course, starting early is better and more effective. So, start on day 1 to 5 of menstrual cycle. There is no break between packs of pills, and this is another difference between progestin-only pills and combined oral contraceptive pills. There is a break in combined oral contraceptive pill, 7 days between strip and another, or back or another. But here, there is no break between packs of pills. So it is continuous and taken every day at the same time. What if the patient start progestin-only pills more than 5 days from the onset of menses? You should ask the woman to take backup contraception like condom. So use of additional contraception. Why? Because she didn't start it early at the best time, which is the first 5 days of menses. Of course, earlier is better. Day one is better than day five. But if she starting the use after 5 days of menstruation, another contraception like condom should be used in this situation for 48 hours up to 7 days. Okay? Should remember that. What if a woman missed dose of progestin only pill? Women who miss taking norepinephrine, an example of progestin only pill, who missed one dose of pill more than 3 hours, or had vomiting or severe diarrhea, so the, the pill considered lost also due to vomiting or severe diarrhea, or the patient missed the pill more than 3 hours. So what you are going to do? Progestin only pills are advised to take the mist. You should advise the woman to take the progestin only pill which was missed. Take this pill as soon as she remembers. Okay? And the next pill at the scheduled time. So if she missed one pill, please, when you remember, tell her. When you remember, immediately take the pill, the missed pill. Then take the next pill at the scheduled time. Okay? Use of additional contraception for 48 hours after delayed dose is also recommended. So tell her to take the missed pill immediately when she remembers, then take the next pill at the usual time. Also use additional contraception for 48 hours like condom. Why I'm saying that? To protect this woman from occurrence of pregnancy, because the efficacy of the pill with missed pill, the efficacy of contraception decrease if there is missed pill. Okay? What are the advantages of progestin-only pills? Important question. Absence of estrogen with its side effect is one advantage for progestin-only pills. Improved dysmenorrhea, menorrhagia, premenstrual tension syndrome, and the endometriosis symptoms. This is another advantage for progestin-only pills. Decrease the risk of endometrial or ovarian cancer. Decrease the risk of PID. It is compatible with the breastfeeding. So you can advise lactating women or breastfeeding women to take progestin-only pill. So progestin-only pill is compatible with breastfeeding. What are the disadvantages of progestin-only pills? Another important one of disadvantages that it must be taken daily with no pill-free interval. As I mentioned before, when you finish this strip, you should continue the new strip or new pack immediately without break. Menstrual cycle disturbance. It was found that those who are using progestin-only pills has more frequent period, lighter period, breakthrough bleeding or spotting may happen. So this is some of the menstrual cycle disturbance that may happen in some women. Weight gain, depression or mood changes, acne, nausea and vomiting, lack of protection against sexually transmitted infections, another disadvantage. Follicular ovarian cyst may happen in some women using progestin-only pills, but you should reassure the woman and tell her that this is harmless cyst and mostly it will disappear without treatment spontaneously. Just do follow up, you will find this cyst resolve spontaneously. It's called follicular ovarian cyst and may happen with those using progestin-only pills. What are the contraindications for progestin-only pills? Suspected pregnancy. Of course, if you suspect pregnancy, please never to give any oral contraception. What else? Unexplained vaginal bleeding. You should diagnose the cause of the vaginal bleeding before you start any contraceptive method like progestin-only pills. So unexplained vaginal bleeding is another contraindication. Breast cancer is another contraindication. Okay, what are the medication that decrease efficacy of progestin-only pill? This is very important question. Why this medication can decrease the efficacy? Because metabolism occur more rapidly due to certain medication, so decrease the efficacy of the pill. Like what? Like certain anti-seizure medication like phenytoin, phenobarbital, carbamazepine, and antibiotics like rifampicin. They are called enzyme inducer, liver enzyme inducer. So metabolism occur more rapidly for progestin-only pill, so decreasing the efficacy of this pill. So you should know about this, either change the medication or change the method of contraception. This is the end of this quiz or OSCE, question in family planning. We covered today the COC and the progestin-only pill. I hope it was beneficial for you, everybody. And this is my books published on Amazon. Please remember to find them on the site of Amazon here. I'll put it in one comment. Textbook of Obstetrics, textbook of Gynecology, Contraception Handbook, Multiple Choice Question Book, Medical Disorder in Pregnancy, and the Gynecologic Oncology book. This is the 6 books published on Amazon, my site on YouTube here, and another scientific site belongs to me on the blogspot.com here. I hope all of this will be beneficial for you. Thank you, everybody. Wishing you all the